PainPal's Great Yarmouth videos are for informational and educational purposes only. Before changing any personal medication, treatments or health routines, it's advisable that you discuss those changes with your doctor or specialist first. Viewers are responsible for their own health and well-being, and anyone making changes do so at their own risk. PainPal's Great Yarmouth will not be held responsible for third-party comments, opinions or beliefs. Anyone wishing to comment on videos is advised to do so with respect and compassion. Bullying and harassment and derogatory comments will not be tolerated and may be reported. PainPal's Great Yarmouth videos abide and are subject to all fair usage policies. The topics covered in our videos are about disabilities, medical conditions and mental health problems that some viewers may find distressing. Anyone experiencing personal distress should contact their health professional for support immediately. Hello and welcome to PainPal's Understanding Pain Part 4. In this video we will look at the emotional effects that are caused by pain. As we learned in video 2, people who suffer with bouts of continuous pain will have physical and chemical changes happening to their brain. These chemicals change our ability to manage our emotional state. The brain requires many chemicals to stay at a certain level for our well-being. For instance, serotonin, which helps the receptors in our brain carry signals, regulate mood and sleep, and endorphins, the chemicals responsible for happiness. Most pain relief medication inhibits these chemicals to help with pain. However, the side effects are low mood, poor cognitive function, and difficulty with emotional control. Depression is the most common emotional side effect of living with pain, not only because of the changes in the chemicals in the brain, but because of the emotional turmoil living with pain causes. You may find that you are grieving because you no longer have a healthy body. You might start to feel guilty. This could be because your family finds your pain distressing. You may try to hide it and avoid upsetting others. Instead of saying, "I'm fine," which people know you are obviously not, try saying, "I'm in pain, but I'm coping with it today." You may find that you no longer want to do anything, even things you used to enjoy. This is because you have lost meaning in your life. You may be struggling to help around the house with daily tasks, having difficulty with helping with childcare, or being unreliable for family obligations and appointments. Feeling guilty about these things will cause depression, loss of motivation, and other negative thoughts and emotions. Even if you are unable to do a full task, you can still be helpful. For instance, while someone is changing the bedding, you could sit and do the pillows. When you feel a loss of meaning, try something new, find a support group, help someone else, or learn a new skill. This will give you a sense of accomplishment that you are missing. Try be kinder to yourself and remember that you are still reliable. It's your body that is not. Often when we experience pain, we start to feel vulnerable and may shy away from people. You may feel anxiety about your current situation, physical condition, or worry about other things that impact your life. You may feel that you're going to be alone, or you may be scared to leave your own home. When you're feeling anxious, take a slow breath in and count to 4. Then take a slow breath out, counting to 4, and repeat. Try to concentrate on something outside of your body. 5 things that you can see around you. 4 things you could touch, 3 things you can hear, 2 things that you can smell, and 1 thing that you can taste. Keep repeating this pattern to help you become grounded and avoid distressing thoughts. It is important that you can recognize thoughts and triggers that cause your anxiety. Then, try reframing negative and unhelpful thoughts. Think about how you are reacting to that emotion and attempt to find a different perspective that is positive and helpful. When you are in pain, dealing with personal difficulty and struggling with your emotions, you may become frustrated and angry. This is a normal emotional reaction to dealing with pain and difficulties. Sadly though, unlike crying, anger is an emotion that can lead you to get into trouble. You likely don't wish to treat others around you badly, however, emotions are difficult to control. A lot of people and organisations will find anger an unreasonable reaction. They may refuse your treatment or even call the police. It is important that you learn to control your anger, especially where it comes to interactions with others. First, sit down and take deep breaths. This will help calm you physically. If possible, remove yourself from any situation where you feel you are not in control. Apologise for your anger. Explain why you're feeling that way. Ensure you tell people that your anger is not directed at them. Find ways to think through your frustrations. Find alternative outlets for your anger, like hitting and yelling into a pillow. During the times when you are calm, think through the situations that caused your anger and make plans for the next time your anger is triggered. It's not always easy to talk to those around you about your problems, but being able to find support is an important part for your well-being. Often, professional counselling can help you work through your feelings in a safe space. You may also find joining an online or in-person support group related to your illness helpful. You can find others that understand your struggles, share your difficulties, and get helpful tips. This support can make a real difference to how you control and relate to your emotions. The most important thing is that you keep communicating with others and don't feel that you have to go through these difficulties alone. Join us for part 5, How Social Problems Are Caused by Pain.